Ooh.
All right.
I don't know. I don't care. But
Matt.
Matt, I was
Yeah.
thinking.
Yeah. Yeah, sure. Yeah, just to follow up on this little conversation we've been having. So,
Oh,
hey, welcome everybody. Thanks for joining us today live, Proactive Health Collective of Keene. Here, we're back. I hope that you all had a good end of the summer. I know we certainly did. And, we're here every Friday to speak about vibrant health. And there is one aspect to health that is so very, very important, and that's taking pause every now and again and changing routine. We all know that we love novelty, we love new things and doing new things, and that includes how we live our day to day. Very easy to get stuck in our ruts. Make no mistake, we're human and we do too. And taking some time off was a great opportunity for all of us to introduce some new things. So today we have a full docket. All this time off, honestly, we've all been on for a half hour together already backstage, and just there's so many topics and things that we wanted to talk about. So one of the many things that we're talking, we'll see how much we can squeeze in today, so buckle up. But we wanted to start out with cardiovascular health. So Becky, I know that you had sort of led off that initial there, and would love to just, start to zero in on what it is that is important considerations here, and also, the different things that we don't really think about day to day that have to go in that, and what we can do about it.
okay. So I'll lead out. I am a holistic health practitioner and nutritionist. I work with nutrients and things like that, and herbs as well. And so I would say cardiovascular disease to me is it is one of the primary killers of our population. But there are a lot of things that can be done to protect our cardiovascular health. There are some things that are primary risk factors for people that they might not know of. For example, I was working with somebody yesterday. We were going through her methylation genetic SNPs, the MTHFR. So she is homozygous for C677T, and that promotes a greater propensity to hyperclotting, right? So sometimes we look at people with cardiovascular disease and we say, oh, you must just not eat right. Or, you must have an unhealthy lifestyle or unhealthy diet. And, cardiovascular disease, if we all just did the right thing, but not looking at these things that make people more susceptible to problems. So if you look at her MTHFR, and then you look at her family history with stroke and with DVT early in her mother and things like that, deep vein thrombosis, so blood clot in the calf. Things like that, you can say, wow, what do we need to do to jump on this and help this person? So one thing I do is to make sure that we're using the B vitamins, folate, methylfolate, B12, and B6 to make sure homocysteine levels are down. And then also to put in something that stops the clotting, so very safely, such as proteolytic enzymes like serrapeptase, which is made by the silkworm, and it digests. If you take serrapeptase with a protein food, it's going to digest your protein. But if you take it on an empty stomach, it's going to get out into your bloodstream. It's going to go to digest non-living tissue like scar tissue, adhesions, things that inflammation, things you don't want in there. But one of the things it does very nicely is the fibrin in the blood that gets sticky and sticks together. So that's a very easy thing to do. There's an extract called Erconia cava extract. It's a brown algae. It's in a supplement called Cyanol or Fiber Boost. And this also helps digest the fibrin, and then increases nitric oxide to dilate the blood vessels and lower blood pressure, things like that. So when we see somebody like that, I look at how do we modify that genetic problem, but then how do we also put in something simple but really effective to stop the clotting, the excess clotting.
So about that genetic, I'm curious. So what's that, the MTHFR, that gene mutation, right? So my understanding is that when that's present, someone's running at, maybe 80% or even 60% power detoxification of what someone without that mutation is. I mean, that could be really valuable information. Am I track there? How would you describe that?
Yes, that's true. So the methylation process slows down depending on on what variant. If you're heterozygous, which is a one gene of the two, or homozygous,
Mm-hmm.
or if you're compound heterozygous. But when you are homozygous for an MTHFR mutation, which I am for the A1298C, which is why my mother had Alzheimer's and why I never will, because I'm practicing epigenetics. I'm blessed to know how to do that. So I'm getting around that. With the C677T, that is the polymorphism in MTHFR that is associated with hyperblood clotting. So we address getting methylation going with the B vitamins, putting that in there, but then we also can throw in something like serrapeptase or Clonia cava extract to say, all right, at the same time, let's just make sure that your fibrin is totally constantly being digested. So we've got like a double protection there. It's huge.
Right, right. And when we're talking about methylation, we're talking about basic biochemical process in the body essential for life, right?
Yes.
Yeah,
Absolutely.
so like foundational stuff here that's super important. So what amazing intel that would be to know that if you're not methylating at, you know, a normal rate, which, you know, besides the setting on a washing machine is just what we'd expect, you know, that in fact, there could be additional support that could really, really help.
Yes. All right.
How about you, Gene?
About me, you know, it's interesting. One of the things that we see a lot in the office, people come in and they have concerns about their heart, and you know, a lot of it with the heart rate, and they think it's a heart problem. It's actually heart regulated by the thyroid. So, you know, when it comes to the rate and the function, it's, you know, and cardiovascular health obviously being important. I mean, one of the major killers in the country. You know, a lot of times it's mistaken, though. You know, people think they have a heart problem and they get on heart medications when they're actually dealing with, you know, other issues, other control mechanisms, nerve system. And the other thing that I just always think about when I think about the heart is that we think of it as this pump that pumps blood, and it does, you know, that's one of its jobs, but the heart is actually 60% neural tissue. And, you know, so you have this massive amount of neural tissue. When you put it together, it's kind of like another brain, or, you know, like the gut. And then you've all heard people say things like, wow, I felt it in my heart, or I felt it in my gut. And so the heart, in addition to being, you know, this major cardiovascular organ, is also an area that we're accessing other aspects of our consciousness, I guess you could say. So just wanted to mention that aspect of it. I know you guys are pretty interested in that as well.
Oh, for sure. Yeah, that's a great consideration. There's so many connections here.
So I want to ask you, Matt, doctors Matt and Tisa Abatelli, I know that with the work you do, that's totally got to be has to be affecting the cardiovascular system.
Oh, yeah.
Right? Oh, yeah. True. I mean,
yeah. So we focus on neurology in our office. We take a look at really nervous system health. To make it super simple, we just acknowledge that stress, like tension in the system, sets up camp and creates dysfunction. And the less tension and stress you have in your system, the more increased function you have. So really nice when it comes to something like cardiovascular health. And I think, Dr. Gene, I think you do this too in your office, sort of monitoring and analyzing the interface between the neurological and cardiovascular, right?
Yeah.
Yeah, super important stuff to be looking at. The heart's not separate. And just like you said, I mean, taking a look at the thyroid, how that's controlled, like everything's connected. The important thing to understand, nothing's an island, right? And so in chiropractic, so we're doctors of chiropractic, we practice network spinal. It's a bit different than your regular, you know, sort of the conventional, what people think of adjustment. And at the same time, the premise remains the same, and that's that a healthy nervous system without any interference, whether that's tension, stress, mechanical dysfunction, poor posture, without that will operate at 100% of its available resource in life. So in other words, it's this self-organizing, self-regulating, self-adapting healing mechanism that you're the proud owner of and that you have for somewhere between 0 and 140 years is the best guesstimate at this point. So how to really take care of that. And we look at the spine. We look at how the spine is the protective armor around your spinal cord, and that the spinal cord is the continuation of your brain. So that means master control from here is coming right down through a big hole in the back of the head and going all the way down through the spine and anchors all the way at the tailbone. It's all your brain, just goes all the way down. And we take a look at certain areas. So your neck, so let's just talk really quick about, stress physiology. That's a big one right now. Like, is there a little or a lot going on the planet? Like, there's a lot. Is there a little or a lot of uncertainty? Like, there's a lot. So that all adds a lot of tension to this thing. And so as that happens, what happens is that then the posture basically adopts a position that is associated with that same thing. So as an example, instead of being upright, so where the ear is over the shoulder, the first thing that happens is that the head starts to go forward, and then the tail starts to tuck under, and then eventually the shoulders will start to run forward. So the posture that you can see in this silhouette is one that you probably see, going to any, I was going to say restaurant, but depending on where you live, like go anywhere where people are just sitting down and they're not thinking about things, and this is the posture you're going to see. In fact, you might even see it a little bit more like this. Super, super common. And what that is that that's just the tension in the system showing itself. So if the head's coming forward and it's going down like this, the neck coming from here actually goes all the way down to about here. So funny enough, right here is where the main nerves supply the heart. Oh, so these are all like crunched down. That's what's going to supply your cardiovascular, and all of the other autonomic functions are coming right out of here that are going the diaphragm and everything else around there. So holy smokes. You just have to look at everything.
And the vagus nerve. The vagus nerve is huge there.
Bingo. That would be a great topic. We should dive into that
one.
one.
Well, but because you're helping with the vagus nerve when you do your treatment, you are helping with all of that nerve stuff, but that's autonomic nervous system, heart rate, anxiety, right? So that plays in there too.
Yeah, so we always say it's a treat, but not a treatment. The chiropractic adjustment. So
I gotta get into the lingo.
So yeah, we regulate. So Polyvagal Theory, if that's something you already know, amazing. There's so much depth and wisdom in that. If that's a new term to you, I'd really encourage you to do a quick Google search or hop on YouTube. There's some it's really easy to learn more about that. But in the nutshell, it's the regulation between our like fight or flight, like rush and din of society system that keeps us going every day, and our rest and digest or our wine and dine system when we really calm down at night. And so the interface between those two gets disturbed, obviously, with stress, and that fight or flight, the rush and din, that sort of like beta world gets elevated. And if it stays elevated for too long, what happens is that the wine and dine, the rest and digest system has to come up to meet it, because we have a bandwidth, and this is a little arbitrary, but there's a certain bandwidth between those two systems. So it's supposed to come back down. And then when it comes back down, the other should settle down too. But if it stays up too long, it jacks up the parasympathetic, and now we start having all sorts of dysfunction because this is real tension in the system. So yes, the work we do in the office regulates the interface between those two, brings the whole thing down, and we see tremendous improvement in the interface between neurological and cardiovascular. And that's just one path up the mountain toward that, of which there are many.
So can I ask you, so do you find improvement with people who have arrhythmias and things like that?
Great question. So that's a little bit of a complex topic, right? So there could be many reasons for that. And also we have to acknowledge that there is a certain constitution to the very matter that our body is made of, right? So the brick wall behind me is solid and in place. If the integrity of those bricks is compromised, if they start to become softer or lose their density, or they're no longer have those nice edges, the wall will become unstable. So we have to first acknowledge just what we're working with here in terms of the actual material of the body. And then, depending on why the arrhythmia is in there in the first place, whether it's pathogen, whether it's stress, whether it's pharmaceutical, which is just another form of stress,
or even an anatomical defect, you know, such as something like
yeah, that's a great example of, so like actual material of the body, like the matter itself, right? Mm-hmm. So that could potentially cause a disturbance. So it really, as you start to track to the root cause of these things, yes, we have tremendous results with arrhythmia. However, you have to look at the whole picture in terms of what's really going on there and why.
Sure.
You know, I wanted to mention that Matt mentioned the heart rate variability test, and it's kind of cool because basically you're using how your heart rate varies to assess or look at and get insights as to how the nerve system is functioning. And it's that's the cool thing, because you can see based on that, you know, if a person is stuck in that sympathetic dominance and how much parasympathetic or healing activity they have. Again, I'm going to pipe in on that. We do check this very frequently, and I would say probably 90% of the heart arrhythmias are thyroid related. They don't have anything to do with the heart, because the heart doesn't regulate itself. It's regulated by the thyroid. And I also want to mention, I think I've mentioned this before in this program, but one of my favorite books is by Joseph Chilton Pierce. It's The Biology of Transcendence. And he spends a lot of time talking about the heart and how when we are stressed, like we have signals from the heart, and that's more like our inner guidance, versus everything that goes on up here is our learned intellectual knowledge, which is good to have, but if you notice over time, it changes. Like you used to believe one thing, now you believe something else. And it's also where stress comes from. Like you don't ever really trust your intellect. And so there's always the conversation, should I, shouldn't I? Is this right? Is that wrong? And that's where stress really comes from, is the conversation that's happening in your head. Whereas what you get from your heart is like your knowings. And it's like, yeah, this feels right. There's no intellect involved in that. Not that you can't use intellect and marry those two, but it's not an intellectual thing. It's a knowing. And I'm sure we've all experienced that, like times in our life where we just knew something like this, I know this is right. And so the key component here is that, again, when we are in this stress mode all the time, we're being drawn away from that ability or that, connection that we have. And then the more we are drawn away from that, the more we spend in the head, which then creates more. So it becomes this, I think people get stuck in this loop because they can't get out. And so, like Dr. Zabatelli will teach something like somatorespiratory integration, where you're actually putting your hands on your body and bringing more connection to these areas, which is, immensely helpful in that. And I wanted to say this, I don't know if it's actually true, but I've heard this many years ago, that your heart has so many beats in a lifetime. So if it's like beating all the time, you're probably shortening your life. But I think it can be said, stress affects all the organs and certainly affects the heart as well. And I think, if you had one component in this, like Dr. Matt said, the stresses can come in many forms, but at the end of the day, it's overwhelming stress to an area, the heart being one of them, not necessarily the diet. There's a lot of false information about diet, back in the 80s, where they were like, oh my God, fat's no good for you, and fat's what causes heart disease. There's absolutely no evidence to support that, actually. And so, we got millions and millions of people on statins to lower cholesterol because it was the thought that cholesterol causes heart disease, but there's no evidence, and there's no lowering of heart disease on these statins. There's actually an increase in heart.
I'd love to jump in on that.
Yeah,
I would love to jump in on that. Okay, first, what you said about so many heartbeats per life. So somebody I read a long time ago describing, it's not just your heart muscle, right? But it's the arteries and everything. So think about somebody stepping on a hose in the backyard, so many beats, so many minutes, so many hours, so many weeks, months, years. And eventually, so this is where Linus Pauling came into his whole theory of heart disease, and vitamin C was all about the collagen breakdown. So collagen support is huge for cardiovascular health. How do we do that? Vitamin C, MSM, which is organic sulfur, is a great way to boost the collagen, very inexpensive and very good for all over health. But he said, what happens is the collagen breaks down, and now you have injury to the arterial epithelium. So he said, if you just rip the plaque, it's filled up with plaque, right? Because it's like a scab. So you don't want to just rip the plaque off. You want to keep the arteries from getting damaged in the first place so you don't form plaque. But plaque is also, we always go after cholesterol, like Dr. Jean was saying, and this is a big misnomer. There's very little cholesterol in arterial plaque. It's mostly calcium deposit. This is why when we use vitamin D3, we always use K2 with it, because this helps remove the calcium from the soft tissues, move it into bone. Otherwise, this is why people on Coumadin, to keep them from forming a clot, have higher rates of heart attack, because it stops the calcium from being moved, because you can't have vitamin K if you're on Coumadin, right? So it stops the calcium from being moved out of the arteries and into the bones. And so they form a lot of arterial plaque. When it comes to cholesterol, I have a really interesting case, because I had a woman with cholesterol numbers, lipid numbers, really kind of out of whack. She's a vegetarian. And so I had her doctor agreed to test for what really the only form of cholesterol that damages the cardiovascular system is called small particle LDL. So small particle LDL, this little hard, gnarly sort of inflammatory, can cause arterial damage. So how do you convert small particle LDL into LDL that's large particle and harmless? By eating saturated fat. And this has been a big confusion in the whole thing, but it's really fantastic, because I just got her results in a year. Her small particle LDL, by changing her diet that way, and we used niacin, because niacin helps with with that whole problem. Her small particle LDL came down from 517 to 184 in a year by changing the diet, by using niacin and fish oil. So this is the thing, and this is what's not being tested when you're going for lipid tests. Nobody's looking for your small particle LDL and the ratios of those things. Her triglycerides came down beautifully. I'm much more concerned about triglycerides than I am cholesterol. So, these are things that, like Dr. Jean was saying, we've been told the low fat thing, this, that, it's been misinformation. We put people on statin drugs. Statin drugs do nothing about particle size. And so nothing.
And that's not standard of care to do that full panel, by the way. That's something that you really have to fight for, is my understanding.
Yeah, and she might have had to pay
incredibly valuable
for it. Yeah, she might have had to pay out of pocket for that.
Right.
Yeah.
I wanted to go into just kind of piggyback on what Dr. Jean was saying about like we have the brain and then the heart brain and the stomach brain, like the gut and the feeling of things. Because, obviously how we feel around our world and the support that we have is huge in our health, right? Because a lot of people survive crazy situations because of the support and how they feel supported when it comes to recovery from things. Like people who aren't as supported tend to not recover as well as others. And I was recently listening, I don't know if you guys know Dr. Joe Dispenza, but he, The Placebo Effect is his book, and he's a chiropractor. And I know we've talked about this in previous episodes, but he's a chiropractor who got in a really bad bike accident and broke a lot of vertebra and was told he'd never walk again. And he is. And so long story short, he is. And through understanding like how he can heal through his mind. He helped his body regenerate, and a lot of therapy. It took time, obviously, but he also came up with something recently that I was listening to about the heart being the actual like control system of what the brain produces, which is kind of interesting. Like science is starting to go to a different realm of thinking. The brain is still the master control system. It tells everything what to do, how to do, when to do it. However, the heart is starting to dictate that, because we're learning that the heart has just as many neurons, maybe a few less than the brain, and how we feel about things is dictating how our brain is processing and sending signals, which is really cool. And so when we were talking about the stress physiology, what, you know, ideally having more upright posture, how you're over your shoulders, hips, knees, ankles, how this particular posture can be a state change for people. And I've heard doctors across the world, one particular doctor in Germany was just talking to a barista in Germany, wherever she was, and she was saying, yeah, if you just change your posture from this to this, it can actually change your whole mood. And why? Because when we're like this and we're in stress physiology, everything is being processed here. We're living our life through our brain. Our brain is like leading our life. We're living that direction. Whereas if we come more up and open, we always call this the high heart position. I always say, imagine a string is coming down, whatever you may believe in, and that, you know, either God or the higher order or the creator is wrapping a little string around your heart, and it's pulling you up, and it's helping you manifest this more upright position. And a lot of people are like, I can't do that. And I'm like, just wait, let it be easy. We'll get to it. Your body's not there right now, so it needs more ease in it. But this position being more upright helps you lead life with the heart. And so when this gal in Germany was talking to this lady, another lady was listening, and it was like she came and told this doctor later, saw her again later in life, and she goes, I overheard your conversation about changing your posture and changing your state, your energy state. And she goes, I was actually at Starbucks or whatever coffee shop it was, and I was buying my last coffee, cappuccino, whatever it was, and I was gonna overdose and kill myself. And she was like, what?
Coffee?
No, well, she was gonna put medications in her coffee and drink it and commit suicide, because she was so unhappy. And she like overheard that conversation and reconsidered and started, you know, just being more mindful and like realizing, wow, I am like this. And she's like, I just started changing my position, and then just happened to run into Dr. Karina, like, I don't know how much time later, I don't remember the actual details, but she was saying, I did that and I totally reconsidered what I was doing. And she had a family and everything. And I believe they're all under network care now. But the interesting point is that if we allow our heart to lead the way, and you know, we go through life and things happen and we're not super happy about them, and so we shut them down and shut them down and shut it down and protect and close off, which is why most people are like this, and they're looking down and they're on the computer, and our habits, daily habits, tend to support that. People are more angry, people are more stressed, disease is on the rise. You know, most cardiovascular diseases are preventable diseases. You know, and we've learned that, right? Stress is one of the biggest factors as to why we get those diseases in the first place. And yes, we can change our diet. Yes, we can get our nervous system checked, and we can do all these things. We just need to realize where we're at and what we're leading life with. Are we leading life with the brain, or are we leading life with our heart? And the heart is now we're learning is dictating the emotions into the brain, and that's determining how the brain is signaling. I don't know all the details to this, but I just heard it recently, and it was very, very interesting. So when we work on the spine and posture is a window to the nervous system, we want to help people come more upright and it be easy, not being forced. not being like a chore, like you have to do, but what if it were easy to sit up straight? What if you didn't have to think about it, you know? And it creates more ease.
Yeah, and I think, you know, physical fitness helps there, because if you're going to have your ears over your shoulders and your shoulders back, you need to have good abdominals, right? Otherwise, you're just going to sort of, your lower back's going to be out, right? So you just need to have good tone. I think muscularly really helps.
Well, it's the whole system. We have to look, you know, we may think locally, but we have to act globally. Like, we have to look at the whole system. It's not just my shoulders are forward, my abs are weak, my back muscles are stretched, my hamstring, my quads are weak, my hamstrings are tight. Like, there's so many correlations of putting it all together. So I see a lot of runners running, and they run with their shoulders up and they run like this, right? They're running. So I don't know why. I'm not a runner, so I can't say why people do that.
You want it, you want your first part of your body to get there first to the finish.
I guess so. It's a race between the body. Who gets there at the destination first, I suppose. But like, if we come back and we run here, run chest out, you know, I don't know the momentum, I don't know, but I just see that a lot. And then I see the posture over time with people who do run like that. And it's like, okay, well, maybe we need to work on that and then work on the rest of the structure as well. So Becky, you're on to that.
Performance really matters there, right? Because so the aerobic exercise, in terms of like performance, aerobic exercise is going to actually increase the size of the ventricle of the heart over time. In other words, it's going to increase the volume that heart is able to actually pump. And then we also know that like weight training, it will, heavy weight training will increase the thickness of the walls of the heart. So in other words, the force at which it can actually pump. So these things super important and need to be combined with everything we're talking about here.
I think it's a good idea, like for myself, because I'm at my desk a lot, right? So I can definitely have that tight trapezius, the forward kind of thing. And then when you think about that, and then you think about minor irritations in a day or something, it might be a good idea when you're like ticked off because your printer is malfunctioning or whatever, you know, just to stop and, you know, just put your shoulders back and kind of stretch back this area. I think that always feels really good to me, because I do know that I'm one of those people that tends to be shoulders forward, and, you know, I'm on my computer and I'm, you know, that's just really tight in this.
One of those few people, right?
That's few people. Yeah, that's like the population.
But that's the key. Becky, that's the absolute key, like being aware of that. Oh, I'm in this position. Oh, my back hurts. Some people may just ignore it. Oh, my back hurts, but what am I going to do about it? Like just that simple notion of opening up. Oh, I need to stretch for a quick
breathing
second.
and taking some time to breathe properly and do that. And just it doesn't take that much time, but just recognize it and do it. Don't just go, wait, don't go from like the morning till the night and finally you're leaving work and go, oh, by the way, you know,
Right.
you know.
Right.
One of the axioms that I've shared with, one of the axioms that I've shared with people many, many times over the years is that the body never lies. And, you know, if somebody says, if you say, how you doing? And they're like, oh, I'm doing really awesome. Like, no. Or if they're like this and you say, how you doing? Oh, I'm really horrible. No, not really. You know, like, and just as Dr. Tisha was saying, you know, one begets the other. So if you're constantly in a state of stress and, you know, feeling bad about yourself, it's really hard. You know, your body's automatically going to take that posture, if you will, that position. You know, but structure affects function, and that's the whole, you know, like one of the major premises in chiropractic is that by intervening in the structure, you can affect the function and the feeling or the experience as well. But it goes both ways, you know. So it's, as you were saying before, the key, as Dr. Tisha was saying, is awareness. Is starting to become aware of how we hold ourselves, because then you have a choice in that moment to do something different. If you're totally unaware, then you have no choice ever.
Yeah.
And it's so empowering then, because really what you're doing in that moment is that you're reclaiming something that for whatever reason you gave up. Because what I can say from working with so many people is that everyone has incredible awareness. However, they've made a conscious choice at some point to cut it out. And it's usually, you know, some sort of grade school thing, you know, that in the moment was a big deal. And you can look back on and say, well, it's, you know, not that much of a big deal, but it was a big deal at that point. So we just like, we put the blinders on and we leave it on. So and it goes so far as like to not even be aware of how we're feeling in our body. And it's like you said, Gene, someone who's like this, it even kind of hurts to do that. But, you know, if you're hunched over and you're not feeling good, lift the heart, put the shoulders back, get the head up. In 5 minutes, it takes 5 minutes. Either one or two things are going to happen. Either you're going to feel amazing. You never saw somebody like this saying, I feel like whatever, you know, or you're going to go right back to the way that you were before because you don't have enough. And this is a global thing too. Don't just like, oh, my state. No, like if you're like this and then you walk through barefoot, walk through some wet sand and take a look at your footprints and then walk right next to it like this, open, and walk right next to it, those two sets of footprints are going to look so different. So different.
I would also like to say that as you're doing that, as you're changing your body, all of that, you might not just go, oh, wow, I did this and I feel so much better. You might feel worse for a while because your body's not used to that, right? So it's in its comfort zone. Yep. Am I right, guys? I mean, you're in your comfort zone. So as you're kind of coming out of that comfort zone and you're kind of forcing your body to adapt a new posture, don't be dissuaded if you have some discomfort while you're doing that, because your body's learning new things and it's adjusting.
100%. And we've actually had that walk into the office a couple of times with different people recently. Some people started care, you know, let's say 3 months ago or 2 months ago, and they're like, wow, I felt so good, and had a lapse, and then they didn't feel great. And then all of a sudden they feel great again. And like, I feel connected, I feel good, you know, I feel like I'm walking better or whatever it may be. And then all of a sudden it just takes a 180 and goes the opposite direction. They're like, I don't know what's going on, but I felt so much better at this point in time. Now I don't feel good at all. And it's like, yeah, this is where rubber's hitting the road. Now we're really, really connecting with some stuff that you've been locked, you have locked away and you've thrown away the key and you didn't want to deal with it again. And now it's coming to light and it's not comfortable, whether it's an emotional stress or like I'm really frustrated or I'm really sad or even a physical pain, you know, like my hips just, I don't know what to do. I don't think this is working. And it's like, no, it's totally working. It's just, you're really connecting with something that you shut off for a long time. And now you're facing it again. And it's uncomfortable, but it's totally okay. It's not going to last that long.
No time like the present.
And this is a crude comparison, because what you guys do, spinal network analysis, is so much deeper than just changing the posture, changing the structure of the body. But think about when people have braces first put on or something. When you wear braces, right? I mean, as it's bringing things into alignment, that's not comfortable. You can have a lot of negative kind of things from that because the body is used to being this way. The mouth is used to being this way, and it's being retrained. So I think,
right.
You know, yeah.
One of my favorite movie scenes ever is when the young Forrest Gump is like running and he's in his, you know, his braces for his legs and he just like breaks free and like the braces come off and he just takes off and it becomes his greatest strength. It's just
I love that scene. Yeah. Run, Forrest, run.
That's right.
Yeah.
Such a great metaphor, you know, having that breakthrough and understanding that manifestation could be so many things. It can be what we're talking about in terms of posture, and all of a sudden like, oh my gosh, I'm not trying to stand up straight and I feel amazing. You know, or it can be in the terms of like needing some extra help, like metabolically for a while, you know, like cleaning things up, getting on certain supplements that are really going to help get you out the weeds. Like those things, that's the exact same thing. Exact same thing.
So do you guys want to transition? You want to talk about neuropathy?
Ooh.
I mean, that hits all of our corners. And neuropathy is a problem for a lot of people. So when we talk about neuropathy, we're talking about numbness, tingling, or nerve pain caused by many different things, diabetic neuropathy, or, I don't know, we have people with things, structural things such as sciatica, or, things like that are structural. And so I think we all can probably weigh in there with what people can do to kind of analyze what's going on, maybe why they have neuropathy, what they might be able to do to help with that. All right, so who wants to start?
I'll just say real quick, I think it's the great, when addressing that, it's really, the first thing you want to know is where it's coming from. And, there's something easy we can do in the office very quickly to find out whether something is organically related or whether something is structurally related. And then once you know, then you know which direction you need to go to get that handled. So,
do you do that by doing your kinesiology, to doing that? So
Yep.
You're saying, hey, this is a diabetic kind of problem, or
yeah, and you can actually trace it back to the organ as well. You can do that with anything, but so if you have, the first thing is like, okay, if someone has numbness, it's like, okay, is it structural? Is it biochemical, organ related?
Yeah.
And if it's structural, then you can trace it back to the vertebra, to the joint, wherever it may be, that structural impingement may be occurring. If it's organic, again, you can trace it back to whether it's like diabetes, pancreas, or
pancreas.
Other things like that. So
Yeah.
really helpful to know what you're dealing with, going into it.
What is that in the first place? So neuropathy being like weakness, numbness, tingling, because the nerve signal's not getting to where it is. And I was just reading on like common treatments. Oh my gosh. Common treatments include antidepressants, because you're depressed that you have neuropathy. Gabapentin, oxycodone. Good gosh, they go
right.
that crazy. Anti-seizure medication and pain relieving creams. Bunch of things to cover it up. But think about what is actually going on. So if the brain and the body are not communicating, and I know both of you guys have heard, well, we've all heard this, but like the brain-body diagram, think about it. The brain is not connecting with the body. It's not getting the signals. The body is starting to dysfunction, malfunction, and this has been happening over time, and it's not doing what it's supposed to do, so things start to go awry. You get that weakness and that pain and the numbness, whatever it might be, and then what happens is it creates less ease in the body. And so that's dis-ease, which is disease, and neuropathy is a disease, right? So the brain is not communicating with the body, and the body is malfunctioning, and it's creating less tension or creating less ease in the system. So therefore, whatever process is about to take place is going to take place. So if we just help restore that communication, release tension, whether again, it came from a physical, chemical, or an emotional stressor, release that, your body's going to start functioning better. You need the support to go along with it, your nutritional support, your physical support, your exercise, you're getting rest, healthy habits along the way to support everything. And therefore you're going to function and you're going to have more ease. I think diabetes is like the one main thing with why neuropathy tends to happen, right? Because there's a mixed signal.
No, what it is glycation. So
okay.
When you have
diabetic neuropathy. Yeah.
Diabetic neuropathy.
Diabetic.
So diabetic neuropathy is the binding of sugar to protein. So think about what happens when you put a turkey or a chicken in the oven and you roast it and the skin gets nice and sticky and sweet. That's glycation. Mm-hmm. And we don't want it happening in our bodies. It's behind a factor in beta amyloid deposition in the brain with Alzheimer's. It's a factor. It's what damages the kidneys, the nerves, and the retina in people with diabetes, because why? They have too much blood sugar and it's getting into all of these little places. So we use a fat soluble form of vitamin B1 called benfotiamine for that. And it has a wonderful ability to help stop the glycation process. And this is also very important for other areas related to health. These are called age-related end glycation byproducts, AGEs. And so wrinkling of the skin, a lot of things like that. So benfotiamine is wonderful for that. But we also find it to be quite effective for people with non-diabetic neuropathy, such as sciatica or things like that, helpful. So that's one thing that, you know, I recommend for people with neuropathy. Again, you don't want people to have diabetes. You know, you want to get to the root thing. You don't want to say, well, have your diabetes and let's just get rid of your neuropathy. But we do want to offer solutions for neuropathy. Another really good one is vitamin B6 in the coenzymated form, which is called P5P, pyridoxal 5-phosphate, combined with magnesium. And these work really well for things like carpal tunnel, golfer's elbow, tennis elbow, that kind of thing. But again, these nerve-related things. And so a good combination with benfotiamine for nerve-related issues like neuropathy.
Interesting. Why would an antidepressant be used?
Because wouldn't you be depressed if you were in pain all the time?
I guess that's true. That's what I thought.
None of those things are obviously addressing any real issues. They're just covering up other symptoms created. But I think, you know, I talk about this a lot, but aside from the diabetic situation, but really upstream in the diabetic situation, in all situations, you're talking about inflammation, really, you know, and there's so many things that you can do from inflammation, and it all goes back to the same stuff and handling the stressors. If there's too much toxicity, there's going to be inflammation. If there's too much emotional stress, mental emotional stress, that's going to increase inflammation. Certain foods, you know, especially things that have been genetically modified or even sugar, you know, are going to increase inflammation. So, you know, one real quick thing, people in the audience, no matter what kind of pain you have, you can reduce some of those inflammation-causing agents, you're always going to be better off.
Yeah.
You're always going to have a reduction in pain and symptoms from there. So.
Yeah, and this, you know, so we have a predominant model that is based on treating symptoms. If something goes wrong, we do something to get rid of the symptom. And I love what you're pointing toward, Gene, here is that if we look at the overall tension of the system, where that's coming from and how that's playing out, there was an amazing article, and this is going way back. So New England Journal of Medicine back in '97, there was this beautiful publication on sympathetic cardio-neuropathy. And so really, like, what happens when you have this sort of feedback in the loop for long, and then how does that play out? So here's like the connection between what we're talking about now and cardiovascular health. Like, you can't look at these two things as being isolated, but in fact, that elevated sympathetic state creates that fight or flight mentality. It has that stress physiology, no matter where it's coming from. And that's how one of the ways that it plays out. And that was 1997. And yet we're still prescribing medication to cover it up. It's just, well.
Yeah, and I think, you know, even when you talk about, for really any chronic disease, including heart disease, you're talking about inflammation. And so if you have, you know, the setup like Becky talked about with the nutritional deficiency, where now you have already fragile blood vessels and so forth, and then you add the extra stress onto the situation, you got damaged, you have the cholesterol patch, but it's really the inflammation piece, and, you know, and the stress is going to add to that. So that's why is stress the great exacerbator? Why is stress, we know that stress is connected to heart disease, but how? You know, inflammation is really the key there, because you're, you know, with stress, you got your cortisol levels up, and you're constantly, you know, you're just increasing that inflammation. And then you just throw in all the goodies like the sugars and stuff like that, and it just, you know, creates a perfect storm.
Yeah, and when you're coming from a nutritional perspective, look at your classic, you know, your beautiful high potency antioxidants like glutathione, like high dose melatonin, like vitamin C. And, you know, things like that just shut off that cytokine, sort of that inflammation. And people are so really deficient in these things. So I would think, you know, I'm thinking about Linus Pauling, going back to his thing about collagen. and the arteries, and vitamin C was a big part of that. But vitamin C is also a huge antioxidant that's turning off this oxidative stress that's so inflammatory. You know, anytime you have oxidative stress, you're going to have inflammation throughout.
Yeah, and I don't know if people really know like what exactly oxidative stress really is. And my understanding was always like, imagine like if you have an old pipe and it's starting to rust, the rust on the pipe is oxidative stress, and a similar process starts to happen in the body. Like, not that you're literally rusting, but maybe you are, like you're cellularly rusting in your cells. So it's kind of the same process because people can hear that word and be like, I don't really know exactly what that means.
Yeah, so let me just explain it the way I would say, and that's a good analogy. But okay, so oxidative stress, these are free radicals that basically attack us. And what is our protection from them? Antioxidants. So they put their hand up. We kill cancer, chemotherapy and radiation is done through oxidative stress. And that's why people have huge side effects, because it's affecting their whole body, this oxidative stress. So that's why antioxidants are so important. And we have oxidative stress from everything, from our environment, from our air, from our foods, from our chemicals. It's a constant onslaught. So these high functioning antioxidants are hugely important. And really, there are very few, if any, degenerative diseases that I've researched that do not have a crucial component of high oxidative stress. So,
right.
Yeah.
And the body creates those antioxidants on its own, and we have way more to deal with now than we did 100 years ago, and even then 100 years prior to that. So while the body can handle this stuff, I mean, getting extra help and starting to look at some of these things to be able to give yourself an edge in an environment that has so many like counterproductive survival values to it, one might say, can really go a long way.
Well, if you go back to the recently published endogenous glutathione deficiency as the key factor in poor outcome of COVID, is again, you have this huge inflammatory response with the SARS syndrome. And glutathione knocks that out because it is such a potent antioxidant. And so that's how vitamin C works for COVID. It's not because it boosts the immune system, that's all well and good. But the problem with vitamin C is you really need IV infusion to get enough to do that, because it's hard for our bodies to accept that much oral vitamin C. With acetylglutathione, that's not the case. But again, this is what we're doing, is we're shutting off that cytokine storm. We're shutting off the inflammation and the oxidative stress. And yeah, it's huge in overall health.
It's like you're putting this amazing fuel into your body, so that like you've got these little motors that are responsible for doing all this stuff, and it's like you just juice them up, like getting cranking overtime, like power yourself up.
Exactly. Yeah. Well said. Well, we got about 5 minutes. Anybody want to talk about headaches?
Oh.
Goodness gracious, your body's biggest cry for help.
Headache. I got a headache.
Of course.
I always find headaches interesting, because I'll ask people, how you doing? Oh, pretty good. I notice you have some headaches. Yeah, but not that often, only like a couple times a week. And I always when I look at symptoms, and I'm sure you're all the same, to me, it's, what does that mean? Even if you can deal with it with an Excedrin, what is it really telling you about what's going on underneath the surface? And again, there's going to be an inflammation piece there every time. The question is, where is it? What's it coming from? And, certainly, obviously, there's tension headaches. Those types.
That's what I was going to say. Like with you guys, with the spinal network analysis, I'm sure a lot of people have headaches because they're all messed up in here or whatever.
Oh,
right?
Yeah, and all that tension ends up at the base of the skull. So when we start to, chiropractically speaking, if we start to look at that, we call this big bone up here, back here, the occiput, right? So that part of the skull, if we start to look at that, that's associated, migraine's huge, also the bone that sits right underneath that. And to, wind this back to where we started with cardiovascular health. So when there's an issue with the articulation back here, that is directly correlated to a decrease in the heart rate variability stuff that we were talking about earlier. So the interface between neurological and cardiovascular. So like Tisa, you just said, the migraine, bad headache, it's the body's biggest cry for help. Yeah, cry for health, right? Like, what do I want more of? I want more health, not less headaches, so addressing that, I mean, huge ramifications right back into the cardiovascular.
Yeah. My thing for migraine is mitochondrial energy. So when you use nutrients that boost the cellular energy, you can often see migraine disappear. So we're talking CoQ10, glutathione, magnesium, B2, oh my goodness, CoQ10, things that, L-carnitine, things that boost that cellular energy, lipoic acid, things like that. If a lot of times you can see that even in women with menstrual migraine, as their progesterone levels come down, when progesterone levels are high, there's a high activity of breaking off a third molecule of ATP to ATD. But in that rapid firing, you've got great cellular energy, and all of a sudden that begins to plummet, and women will get these menstrual migraines. And you can really overcome that with those nutrients in many cases. Just make sure those are in there and keep that cellular energy high.
Just curious with like today, if people wanted to boost their systems, whether they're getting headaches or they have cardiovascular or neurological concerns, like if people were going to be taking, something to support their system overall, like I know my mother has mentioned like lysine because somebody else is taking lysine, or zinc because it helps, with the immune system, immune function. Like, wouldn't just a really good multivitamin be efficient in general? Or are we looking for specific
It would be
things?
helpful, but if you have, if you have a need for, if you have a need for more mitochondrial boosting nutrients or something, a multivitamin is not going to cut the mustard, but it's certainly a start, for overall. Yeah.
But just like, I mean, I'm not sure what, why she was mentioning lysine particularly, or why my cousin was taking lysine on a daily basis.
Lysine, but, people usually take lysine because they get cold sores. They have some sort of a herpes thing.
That's my knowledge of it. I don't understand like just taking it to take it.
Yeah.
I don't know. I was just thinking maybe a multivitamin or something, zinc, taking zinc to help boost the immune, because that was like the big thing, right? Right after COVID came out, take lots of zinc and quinine or whatever. I can't remember all these
different ideas, yeah. Well, I think the mitochondrial support is huge, because think about, so the amount of tension the body would have to create that kind of headache is enormous. And if your body's carrying a lot of tension, it's using a ton of energy. And not only is it using a ton of energy, but as you pointing towards, Jean, it's so inflamed, like crazy, so all of these things, all of these pieces here really, really matter when you're looking at this stuff.
Yeah.
It's probably also why, there's a lot of different windows in ways that you can address these things and still get a shift or a change, because there's so many aspects to it. So, anywhere you intervene, you're going to create enough, you can create enough of a shift.
Yeah, absolutely. And then going back to what you were talking about, Dr. Tisa, with the, the heart being your guide and feeling, and, you can check out, I think was it the Heart Math Institute or one of those that's got tons of information on how, the field of the heart is so much bigger than the brain and how it does influence all these things. And to correlate that and put that on the ground here, you all have that ability within you. You all have the ability to be able to, feel into and have that knowing, like you were talking about, Jean, about, what it is that you need for yourself and what you need, to go and do for yourself. And just to, say again that there's so many ways, so many windows in to these different concerns and optimizations ultimately for yourself, and that you have the wisdom within yourself to know what's congruent and true to your own authentic nature. And we'd love to just encourage you today to follow that, and don't wait. Don't wait to be well.
Be proactive.
Be proactive.
You have much more control than you think you do.
There it is, boom.
Much more control than you think you do. Yeah.
Mhm.
Grab it back. Take it back. Take your life back.
Awesome.
All right.
Wow.
It's about that time, right?
Yeah.
Thanks
Hey,
for
we love you all
joining.
this much.
Thank you, everyone, for tuning in. See you again
Oh,
next time.
Hope you
Yes.
guys have a great Labor Day weekend.
Yeah,
Do some
happy holiday, everyone.
self-care. We'll see you next
care.
week.
Be
All right,
well.
take care.